What's up, everybody? Khaled Umura here from Insaga.com and Halton.com. And I have the mayor of Burlington on with me for the 70th week in a row. How you doing?
70th week, wow. Pretty impressive. It's all good. Yes.
19
it's all
months.
Good.
Yeah. So
yes. Wow. Time flies, eh? It's good. Yeah.
So
it's all good.
A lot of questions. Let's start off with Halton Public Health has extended the proof of vaccination to sports facilities for another 12 weeks. Are you surprised this happened?
Well, this is to allow everyone a bit of a grace period. So if, because the announcement was made about the restrictions but it wasn't even available to some people to that age group for a long time, right? So it's just about providing a grace period for people to get it done.
Okay, awesome. Is that Boston?
That is Boston. My son's gonna let him out, but yes, he's making himself. It's that time of day. He's making himself heard.
So, and I guess once the 12-week grace period is up, who's going to enforce this, or are you just confident that everybody will be vaccinated?
Well, as it relates to sporting facilities, in the city's own facilities, we do have staff that are checking. So you can't come in without showing proof of vaccination. Private facilities, if the rules aren't being followed, that would be a separate enforcement arm. That would be a call to our COVID hotline, and our bylaw officers can come out. But in our own facilities, we've staffed up extra to provide people to check this. So yeah, you won't be coming in after that 12-week grace period if you haven't taken the steps you need to take.
Okay. This morning we got real estate news. Halton real estate has gone up more than 20% since 2020. Is that good or bad for Burlington and Halton? What are your thoughts?
Well, housing affordability is probably the number one issue, concern, fear that I hear from the community. People of all ages, even people who have a home and are in the housing market but are looking to downsize. It is next to impossible to get into something that suits people's needs because everything is so expensive. And I just read a report, and I'd been hearing this from the development industry, but just saw a report that single family homes are approaching the same cost or vice versa as condos. So condos are approaching the same cost as single family homes. So what used to be relatively more affordable is also escalating. And so we have a City of Burlington housing strategy that we're working on. I'm a member of the committee of stakeholders. It's chaired by my council colleague, Shauna Stolte. Councillor Sharman sits on that, as well as a whole host of residents and stakeholders, including members of housing providers, social services, the development industry is represented. And we've been working for months to come up with a strategy in the city that would give us, first of all, outline what areas of jurisdiction we have or don't, what tools can we employ, and then what becomes advocacy to other levels of government to help us out. But this is the single biggest issue. And we hear it described like this: I can find something for a price I can afford, but it's not suitable to my needs. And by that, people mean, look, if I've got $400,000 or $500,000, lots of money to buy something, I can get a 1-bedroom condo, and we're a family of 5.
Yeah.
So people are not able to find housing that suits their needs at a price they can pay. It's not attainable. And so there's a huge mismatch. A lot of the units are being bought by new units are being bought by investors. We've seen that happen. And so we have a national housing crisis. This isn't a Burlington only issue. It's more acute in heavily populated areas like the Golden Horseshoe that we're all in.
Yeah.
But it's across the country. And it was one of the biggest issues in the last federal campaign. They have announced that they're going to be working on something. We need funding for that. The province is aware of this, and we all have a role to play. It's a different role, but we're hoping to get a report back in a draft report by the end of this year with some preliminary findings and some some of strategies and options by middle of next year. And then we got to get going on it, because it, like I said, it is the biggest issue that we face. And if you're buying into the market, you can't get in. If you're selling, you can't necessarily easily transition to what you need that would be better. And so it's a huge issue. And people are in many cases staying overhoused in places because they can't afford to move to a different place.
Just type in $1.2 million in Windsor and see what you get. So
I'm afraid to look. The housing prices are, and the other thing that is really difficult for people, especially if they're new to the market, you might have a budget in mind, but there's bidding wars, and so your budget is blown apart. So you almost have to look for something that is less than your budget to anticipate the fact that it's going to get bid up maybe to what you can afford. So it's very precarious. It's very challenging. It is a crisis nationally, and we're doing what we can within our area of jurisdiction to try and figure out some responses to this to help our community out.
Are you surprised that Burlington itself was kind of like spotlighted as the kind of the 20% increase?
Well, everyone wants to live in Burlington.
Yeah, okay.
It's a great place to live, but right. Burlington is particularly challenged compared to some of our other neighbors immediately around us, like Milton and Oakville. We have no greenfield land. We have no subdivision land. We have no mass tracts of land left for the kind of housing that we're seeing come online all around us. We only have infill. And that means high density. It's much more complex. These projects take years. When you look at planning, when you look at design, when you look at actual construction before they're occupied, these buildings are years and years off. And so we know what's coming in the pipeline. We have 45 multi-residential applications, somewhere in that neighborhood across the city.
Okay.
Some of those are multi-buildings, like 7 stories, 7 different towers on one application, or 3 towers on another application. We know what's in the pipeline. There are thousands. We got a report on this recently. So it's in the neighborhood of 19,000 units that are in the pipeline. But it will take years before those come to any kind of fruition, and the housing need is now. And we can't be sure that those units will match what people are looking for. True. Because if it's a 1-bedroom, a family of 5 ain't moving in there. And True. There's a reluctance to build 3-bedroom units. There's no space for us to build, single family or even mid-rise or townhouse. There's a few parcels already left that will be built in the next couple of years that are already pre-zoned. But after that, we're out. Like, we have no more land. And we're not building into the rural area. So we're different than just about every municipality around us, because we can't grow out. So we have to find a way to solve this within our built boundary.
Today was the first day of budget deliberations. Is there kind of a tax increase that you guys have come to the conclusion?
That's the work that we're going to undertake in the next month or so. So we expect to have a budget ideally by middle of December finalized. Today was the kickoff. So we just got our budget books yesterday. We had a preliminary high-level report that was released about a week ago. And we knew that the initial proposal from staff was at about the 5.5% city increase. And of course, in Burlington, your taxes are made up of 3 sectors: city, region, and education. So when you blend it all together, it nets out to an overall impact for folks of about 3%. This is my 11th budget at the city of Burlington. We have never, ever just accepted what was initially proposed. We've always found ways to reduce it. And sometimes we also added new things. So we go to work now. So staff have done their work. Now council goes to work and decides what we want to keep or postpone or eliminate altogether. And that work will be done over the next couple of weeks. So I can tell you, I'm not supporting 5.5%. I will be looking to bring that down. And you know, I've already kind of looked at where we might be able to do that. And you know, here's how I look at budgets. The city has huge needs, and those are over multiple years. We have a 20-year asset management plan. We have a 5-year plan to reset the organizational design and the staffing needs that we have for all the new services that or increase in services, for example. So we've had a 200% increase in building permit applications, as a for example. So we know we need to add more staff. That's a 5-year plan. So a budget any given year is how much can we do this year, and how fast do we want to address those issues? And you can't do it all in 1 year. So so you have to phase it out over time. And I look at the tax rate, like the speed limit. How fast do you want to go? If you want to go real fast to solve all these problems right away, you're going to have a huge tax increase. If you want to slow it down and phase it in into something that's a little more manageable and reasonable, your tax increase rate will go lower. It's kind of the speed limit on the budget highway. So 5.5 is too fast a speed for me. I'll be looking to slow that down and phase that in over a longer period of time. So, you know, stay tuned.
All right. So it's not breaking news. 3%. Okay.
It is not breaking. We didn't vote on anything other than to receive the information and, you know, subject to any additional edits or reductions, additions that council brings. So the big meeting that folks will want to tune into is November 30th. That's the day where any motions will be brought forward by members of council to add or reduce or shift or postpone or whatever it is we want to do to kind of soften that increase.
Okay. 88% of Burlington city workers are vaccinated. 12% are not. What can the city do to get the 12% vaccinated? Because I hear that you eventually will have to pay for the tests out of your own pocket, or the taxes pocket.
So we took an approach that was perhaps a little gentler than some other municipalities around us. A number of municipalities, if you're not vaccinated by a certain date, you don't have a job. Period. Full stop. We took the approach of providing some accommodation. So you either had to be vaccinated or to come into a workplace. And that could be, if you're a roads and parts worker, that's getting into the truck and going out to the field, that's your workplace, or coming into the office, you had to provide proof of a negative COVID test. And that's for everyone's health and safety. During a brief transition period, we said we would cover the cost of that, but after about mid-November, we will not be covering the cost of that. We hope that will encourage more people to get vaccinated. We are also exploring whether we need to simply move to to work here, you need to be vaccinated policy. We're not there. We've tried to take this other more voluntary, encouraging approach with people, and you know, the numbers are reflective of Halton as a whole. When you look at all of Halton population in terms of double dosing, we're a little higher actually at the city. So it's in the high 80s for first dose Halton region wide. So our city staff are reflective of what's happening out in the general public.
Okay. Last week, you were very passionate about the Ontario Lands Tribunal's decision regarding Lakeshore Road development. What's next? Have you heard anything back?
We are exploring options, so stay tuned for more.
Okay.
We are very committed to exploring options that might be available, so stay tuned. Right. Yeah, it's a decision that really doesn't respect the community voice in terms of what they see as their vision. It disregards the City of Burlington official plan for this area that was recently updated. It calls for 17 stories in that area. And, you know, so it's not a decision that's reflective of our vision. And so we're going to explore what our options are. Okay.
Burlington developers hosting a public meeting to discuss the high rise in Waterdown Road. Can you talk about that?
Yes, this is what we call a pre-application meeting. And it's a made in Burlington unique approach to development where we ask any potential applicant, before you even bring in an application, go and talk to the community, show them what you're thinking, listen to their feedback, and incorporate that feedback into any eventual application that you submit. That saves everybody time and money, and that's a great collaboration. So we bring residents right in on the ground floor before there's even an application put forward. So that's what this meeting is. There's nothing in front of us. There's no approvals. There's no application. It is this opportunity for the community to get in right at the beginning of a process to express their views about what is being proposed. So I haven't seen the proposal either. I will get that view when the community does, when we all go to the meeting and hear what's, I mean, I've got the notice, so I have a general idea, but we'll hear more from the applicant or potential applicant, because they haven't brought in an application yet, about what they have on their mind. And you know, it's an opportunity for the community to say, look, we like this, or we don't like that, or if you changed it in these ways, we could support it. That's really valuable information for the potential applicant. If they actually put that into their application, it will help to speed them through the process. If the community, always better to get the community on side from the beginning than to kind of launch something on them and you know, and then it's just reactive. So it's much better to be proactive. And again, this is a process that I employed as a counselor for the 8 years that I was serving. It was voluntary, but that now is city policy. Okay.
Christine Elliott was just on TV mentioning that she's not going to mandate, or the Conservatives are not going to mandate vaccinations for hospital workers. What are your thoughts on that?
I support mandatory vaccines for hospital workers. Anyone in the healthcare sector, they more than anybody know or have access to the information to know that vaccines are safe, they are effective, they save lives. And when you are directly caring for people who are vulnerable and sick, that's why they're in the hospital or they're in the healthcare system in the first place, you have a higher obligation and duty and responsibility to keep your patients safe. And that means keeping yourself safe. I've been astounded. I used to sit on the Joseph Brant Hospital board, and I remember the first time I learned that we couldn't impose flu vaccines. The hospital didn't have the power to make that mandate at that time, and I was astounded that you know, people in healthcare were not getting the flu vaccine, knowing that flu will kill patients who are immunocompromised or in hospital with other illnesses. So I've always believed that in certain sectors, for sure, you have a higher obligation to keep yourself and others safe, and that's one of them.
And I see the poppy on you. Can you talk about the Remembrance Day ceremony that Burlington is doing?
So once again, at the request of our veterans and our Legion, they're the ones that organize the Legion service for us. We do partner with them, and they've asked for it to be virtual again this year, out of respect for the veterans and for the amount of runway that's required to plan these events. A lot of people don't realize that the planning starts months ahead of time. So just because we, you know, capacity limits increased, you know, a week ago doesn't mean you can turn on a dime for some of these larger events. So it will be virtual. It will be live streamed at burlingtonlegion.ca at 11 o'clock. And we do encourage people to tune in and pay your respects at that time. Wear your poppy in advance. So they're all over town being sold. You can also come down to City Hall. We have a poppy poster you can put in your window. It has details of the virtual ceremony coming up as well. So we really do encourage people to participate. It's a little different this year, like it was last year, but there's lots of ways to pay your respects. So please do that.
Awesome. And Mayor, is there anything else you'd like to talk about? Those are all my questions.
Well, let me see. I think we've hit most of the issues.
All right, okay.
Leaf pickup is coming.
All right, okay.
Yeah, I don't have all the dates off the top of my head, but soon, like this weekend, the city's leaf pickup program starts again. So check your zone in the city. The trucks will be coming around to vacuum up the leaves starting in a couple of days. So let's hope the snow doesn't come.
In Burlington, you could put the leaves out on the curb and it vacuums it up?
Yes, we're very
Wow.
civilized.
They don't
in
have that in
Burlington.
Mississauga. I'm so glad I'm moving to Burlington.
No, they don't. They don't have it in a lot of places. So
Wow.
we have a gold-plated leaf pickup service. It's something actually that the residents asked for. They really do appreciate it. We have a lot of trees, and so if you can rake your leaves out to the curb in nice, neat piles, the city will come by and suck those up with a vacuum and take them to our compost place up at Halton region.
No wonder everybody wants to move to Burlington. So
There you go.
all right. Mayor, thank you so much. I'll catch you next week.
Thanks a lot, Khaled.
Okay, see you later.
Bye-bye.